What is the government's strategy to tackle Omicron variant? The government spelled out its strategy to tackle the new variant of concern and also answered on contentious issue of the effectiveness of vaccine and booster doses. The center Thursday announced that two cases of COVID-19 variant Omicron have been detected through genomic surveillance in Karnataka. The government spelled out its strategy to tackle the new variant of concern and also answered on contentious issue of the effectiveness of vaccine and booster doses. What did the center tell about the severity of diseases in the 2% detected with the Omicron variant? The center said the symptoms are mild as of now. In the cases of Omicron detected in the country, we are not seeing any severe symptoms. Love Agarwal, Joint Secretary, Union Health Ministry said this is in line with data emerging from other countries that while Omicron is found to be more transmissible, the patient have mild symptoms. Scientific understanding is that whole-killed virion-based vaccine, Covaxin, may have a wider antigenic presentation and the broad spectrum of effect against the new immigrant variants. But we have detected only two Omicron cases, and unless we isolate the virus, culture the virus, and test the virus in a laboratory setting, it is premature to comment on the effectiveness of the vaccine, Bhargav said. The head of India's COVID-19 task, Dr. V.K. Paul, said vaccine manufacturers are also examining the issue of vaccine efficacy. What is the public health strategy to tackle the new challenge of Omicron? First, the health ministry said that the public should not panic and that the emphasis should be on strict compliance of wearing masks and getting the eligible population fully vaccinated. COVID-19 appropriate behavior is required. Use of mask, hand hygiene, and not going to mass gathering will help break the chain of transmission of Omicron, Bhargav said. Paul said that vaccination continues to remain the most critical tool. We are fortunate that we have the tool in abundance. There is no doubt we have to increase the coverage of vaccination. At this point, science tells us that we have to use vaccines. The new variant may dent the efficacy of the vaccine. To some extent, we said the same thing about Delta. It does not matter. We need to look at the big picture. Through fully vaccination, we need to protect every individual. We can't have any backlog of the second dose, Paul said. What is the status of providing booster doses? The center also said that scientific reasoning for providing the booster dose is under examination, but the focus is to fully vaccinate the population. We are still learning about the characteristics of Omicron and its impact, not only in India but also abroad. Diagnostic tests are working. Vaccination has to be pushed because it is protective. This is the information we have. When new information emerges, we will look into it. We are closely studying the imperatives of a booster dose. It is an ongoing exercise in our technical and scientific circles. All that is being carefully examined. As the situation unfolds and more scientific evidence emerges on Omicron, we will take decision in the future, Paul said. Will the government impose a lockdown? No, the head of India's COVID-19 task, Dr. V.K. Paul, also said there is no requirement for the imposition of any lockdown. Instead, he said that with the emergence of Omicron, it has become even more critical to strictly adopt the universal vaccine, that is, the wearing of masks. With the emergence of the new threat of Omicron, there should not be fear but responsibility. It is an unfolding situation. We are learning, but we are ready in every way. This is the mantra we will take forward. The countries that are taking masking very lightly are seeing a surge in cases. Masking is very important. Avoid crowds and people to gather in very well ventilated spaces, Paul said.